Right on, guys. Thought I'd do a bit of an update as things are going along here now in regards to my bladder issues. Last video I'd done, I think I'd had my first round of 300 units of botox, which was quite a traumatic experience because I had an excessive overstretch from my bladder, which left me in a lot of pain. And it upset my capacity quite badly. I ended up with quite a varying capacity of between 100 and 200 mils after that, and that sort of carried on up until I had my third round in July. So I think I did see Matt Hodgson again. I think when was it back in? I think we saw him back in June. No, I didn't see him back in June. I tell a lie. I emailed him because I got about 7 or 8 weeks after my 300 units, and it was urgency was coming back. I thought, this is not brilliant, because obviously when I had 300 units done in the May, injections were only done in the paratragon and the rest of the bladder, which is standard procedure, but it was not how it was recommended from pressure. Hashim up in Bristol, he recommended 4 in the tragon and 11 in the power and the rest of the bladder. So I messaged Matt Hodgson and said, look, can we get booked in for another round of Botox, because my Botox is wearing off. And I was lucky I got in end of July up at Trelisk. It was on the plan K unit this time. It's a little unit in what used to be an old ward down in the Link Corridor. Anyone who knows Trelisk. It's just a day case unit, basically. Mixed rate waiting room, which wasn't ideal. And obviously there's quite a few of us, because I think there was 4 specialities. One being urology. There was a youngster among us. I think he was only in his early 20s. Hopefully he was nothing too serious, too young to be starting the kind of problems that I've got. So I had a chap called Murugasan. He's the other Indian urologist up at Trelisk. He's absolutely lovely. If all the urologists at Trelisk were like Matt Hodgson, Mr. Murugasan, and Helen Texera, brilliant. If they were all like that, you couldn't ask for better. Went in usual chat, bifid urethra, used lower opening. I asked for a stretch of no more than 400 mils that time. I wasn't going to risk a repeat of what happened back in May, certainly not. I asked for 4 injections to be put in the trigon, which is not normally done. It doesn't tend to be done normally on basis that it can put you in retention. I'm in retention anyway. I started cathing, as from my previous videos, I started cathing after my first round of Botox back in February, and I've not gone out retention since, which is fine. No, it's inconvenient, but no, that's part of life now. So he had me take, looking back through all my notes and emails, he had me take a couple of paracetamol before I went down the theatre. Woke up, brilliant. No spasm in, no feeling like I was busting for a pee, no aching, brilliant. So that round lasted about 10 weeks, and I've been put on the, what they call a permanent waiting list now. So every 8 to 10 weeks I'll get a phone call about an appointment to book me in for another round of Botox, and this is going to be pretty much for the rest of my life, unless something drastically changes and it either be not necessary to have Botox anymore or Botox stops working. Hopefully it doesn't. So I've been in again just recently. I went in Wednesday the 11th. I saw Mr. Murugasan again, more luck than anything else, I think. This time I said, well, we'll go to 500 mils, because I know 500 mils was a good number, and then Texera did a stretch of 500 mils back in February. Fucking hell, I wish I'd not bothered. I woke up busting for a pee, or it feels like you're busting for a pee. And I was in that much discomfort, they must have dumped 30, 40 mils of Oromorph into my IV. The general anaesthetic wasn't particularly pleasant either. The anaesthetist I had this time, instead of using the old syringe of milky propofol, which normally is all right, she'd give me the drugs and the drip, and fuck me, did it hurt going up my hand. They said, it'll ache. Felt like somebody stuck a knife in my hand. They had to slow the drip back until I was out, because it was hurting that much. So that was the first time for out of 6 anaesthetics which I've had now. Just Thursday was my 6th general anaesthetic in 12 months. Yeah, it was the first time it really hurt. Sometimes it would sting, be a bit cold, but yeah, it was one what I called 8. It hurt, and it hurt bad. Obviously, when I woke, it was the usual. I feel like busting and going for a pee. So I've emailed Matt Hodgson. I said, in future, we only do 400 mils. I know 400 mils. I can wake up comfortably, and be honest with you, a little bit extra. He's not worth the discomfort. When I wake up, really, I'd rather wake up comfortable or maybe a little bit aching from the botox injections. I can't be doing waking up busting for a pee. The first time was understandable because it was first stretch. I had the second time again. They stretched the bladder a little bit more, and after that, overstretched back in May, I thought I don't really want to be in that situation again, especially because it left me in a lot of pain for 4 days. And I thought, oh yeah, 500 mils would be all right, but yeah, just that extra 100 mils, no. When you weigh, you can't describe the sensation. Even if you woke up during the night busting for a pee, he's just a constant pressure and spasming. All you want to do is strain as if you're trying to go for a pee. That's all you want to do. No, sometimes it settles, and he just wouldn't settle. I took a while. It must have taken a while to come around. Normally after Botox, I'm awake within an hour and a quarter of being knocked out. This time he was 2 hours. I went down at 4:30, and I was awake in recovery, what we call consciously awake. No, not vitally awake, but consciously awake. There is a difference between the two. You're vitally awake within about 15 or 20 minutes after they stop giving you the general anaesthetic. But between when you feel your eyes close and when you wake up again, is when you will be classed as consciously awake. You're aware of what's going on. I didn't go down till Eden Wall was full up. It was all people from A&E. Shouldn't happen, but that's what's going on at the moment. And they talked about Newton Wall, which is where I went back last October. Again, it's just a general that they do care for people who've had oral surgery, or ear, nose and throat surgery, all those kind of things. I ended up going back down to the planned care unit, which that's ideal because I'm not going to get thrown out too quickly. So I got sent down there at 7 o'clock. Still fairly groggy. There's right on changeover, staff changeover time, which wasn't ideal. Just come around with usual sandwiches, crisp yogurt, all that kind of stuff. Tea. I take my own tea bags now. We always option tea or coffee, but they don't really carry decaf, so I always take my decaf tea bags with me. And I've got a bit of a ritual now after a cystoscopy. I'd have 2 mugs of tea and a full 750ml jug of water that they give you, and I drink all that before I go home. Because of the oromorph they give me up in recovery, things were taking a bit of time for the bladder to wake up. I was sat there thinking, I should need a pee in a minute. And it got to about 8 o'clock, and I thought, well, I better get out of bed because I need to go for a pee before I go home. So I got up, and within sort of like 10 minutes of sitting in the chair, I thought, I need a pee. And that allowed me just to flush. I did cath up in recovery, but I don't know what it was. It was like 50 mils. You could hardly see it running out the cath into the bottle, really. And obviously drain out the worst of the blood. There's a lot with injections, really. I get a little bit, and you get a little bit of tinging for a few hours, maybe up to you go to bed, just dragged out on the cath. I said apparently you get a little bit more bleeding if you have injections in a trigon, but I'm on a saw metal, which can thin the blood as well, so I don't really notice. The only severe bleeding I had was obviously with the overstretch back in May because I had bestial hemorrhaging, which I haven't had, which we know I don't get over 500 mils anyway. I wouldn't like to say at what amount over 500 mils I get bestial hemorrhaging, but we know we don't get it under 500 mils. I went for a pee a couple of times, and I said, look, no, you happy for me to be discharged because you're on the night staff now, so no, if they're running thin on the ground, oh yeah, we're happy for you to go home. So I think it was nearly 10 o'clock before Mrs. come pick me up. So I've been in there since about 10 to 11 in the hospital since 10 to 11 this morning because the afternoon shift was running late. And by that time, the aching had sort of settled down. I somebody offered me more painkillers. I said, I won't bother. The time I got home, I took some paracetamol before I went to bed, and then yesterday I was pretty much right as rain again, really. I said, obviously, I don't have to worry about burning in the urethra now because I cath. I use instead of gel. It's a little bit more uncomfortable after a scope than cathing generally, but I go quiet. You've got the instead of gel. It's not really too much of an issue. I said Botox now is part of life. He's something they've got to have every 10 to 12 weeks. Indefinitely, really. We just discussed with Matt Hodgson back in April. I was a bit concerned about whether the trust would continue funding it, and apparently because it's a it's a known form of treatment that works. They're quite happy to fund five lots a year, which I think is what it's going to be, roughly about five doses a year. I can't. This time, 10.5 weeks, he was only just coming back. There's a little bit at night, maybe a bit during the day. And I'd obviously had 2 weeks where I'd come off my saw palmetto before I had my nose up, which is in my previous videos. And I'd already had then 2 weeks coming back on it, so I had nearly 4 weeks without any saw palmetto, and I had quite a few flares, a lot of aggravation. Again, I'm going to have to come off that when I have my big op next year. So, in terms of operations, I have been referred to Bristol under Professor Hashim. Mr. Hodgson sent the letter up end of July, so that is in the pipeline now. That is going to be the way forward. I don't know, I talk much about the bladder augmentation. It's quite a rare operation performed. It's only performed a handful of times across the UK every year. Professor Hashim is one of the few surgeons in the UK is actually qualified and trained to do reconstructive pelvic surgery, because that's what it's classed as. Is a lot more complicated than a urostomy, which is just a case of taking your bladder out and giving you a stoma, basically. In terms of cancer, they do it in extreme cases for IC. I think I did go over my last video. We had a bit of discussion, and I had a choice. Professor Hashim wouldn't give me a choice of cystectomy, though. When I saw Matt Hodgson back long, we did discuss a cystectomy, and I said, well, those blokes that I've spoken to, regardless of what a surgeon might promise, they'll say, oh yeah, we can do nerve sparing and we can do prostate sparing. Nobody's going to guarantee you nothing at the end of the day. And all the blokes I've spoken to, losing most, if not all, of your sexual function is pretty much a given with a urostomy. You know, if in the day you've got severe bladder cancer, no, you want to live, so you're going to trade one off for the other. But considering my quality of life is poor anyway, I said, at the end of the day, I'm not prepared to lose any more on what I could gain, from better capacity and being able to go back and drink what I want. So really, a cystectomy was off. Matt Hodgson would have supported my decision for a cystectomy, but I said it's a non-starter. Professor Hashim didn't offer it anyway because there's no cancer involved, so I only had option of bladder augmentation, or what they call paratrigonal cystectomy, where they cut away all the bladder other than the trigon and sew it back with bowel. But then, because your reservoir, then I won't call it a bladder, it's a reservoir because it doesn't respond like the bladder, is then 95% bowel, and there's a much bigger risk of mucus. It's going to be a risk of mucus anyway. It's something I'm going to have to deal with. Regular bladder washouts 2 or 3 times a day to keep the mucus moving. So I opted for the standard bladder augmentation. For those who don't know what it is, basically they cut your bladder open like a clam and sew an isolated piece of small bowel over the top, giving you a high volume, low pressure reservoir. I'll call it a reservoir because it's still a bladder, but it don't react like a bladder anymore. There's no muscle strength in it anymore. It basically just acts as a reservoir. Unfortunately, there's only a 50% chance of it actually doing anything at all, from what Professor Hashim said. Again, because these operations are only done 300 to 400 times across the world. It's not UK, across the world every year. There's so little data from the draw on. It seems to be good data for those that have a neurogenic bladder caused by spinal bifida, MS, Parkinson's, any kind of neurological spinal issues. But unfortunately, anything relating to IC, it doesn't tend to bode very well. Sensory urgency is a big issue. Obviously, we've got that under control with the botox, and obviously the augmentation doesn't stop the sensory urgency. All it does is increase the capacity. Now, the hope is, the reason why I don't have the capacity I should do is because of the damage in the bladder wall. They know there's inflammation in the bladder wall, but there's no obvious scarring. There's no signs that there have ever been any Hunner's lesions, which only about 5% of IC patients get. I got what's classed as end-stage IC, which again only 5% of people get. Why is it classed as end-stage? Basically because your bladder's fucked at the end of the day. It's very rigid. It's more pliable under general anaesthetic now because of the Botox, but it's still poorly compliant. No, end of the day, it won't stretch as it should do. And my thoughts is that because the bladder's rigid, it's setting off sensations of being full when the bladder isn't full. Now, hopefully, when the bladder is cut open and a piece of bowel is sent over the top, because the bladder doesn't have to stretch anymore, it is just an open vessel or a reasonably open vessel, I'll be able to carry 600 mils daytime easy, hopefully, as much as that. Maybe up to 1,000, 1,200 mils overnight or under anaesthetic when everything's healed up. The best case scenario, I get my capacity back 500 to 600 mils. Hopefully, I'll be able to either reduce or come off all my bladder meds and hopefully go back to drinking a fairly normal, very dark within moderation. Now, I ain't going to be able to go back on pub crawls or necking back gallons of fizzy drinks or fizzy alcohol or caffeine, but hopefully I can, get back some kind of normality in what I can drink. We'll hopefully have to go for a pee 3 or 4 times a day as opposed to 10 on a good day and maybe 15 on a bad day. With the sore palmetto now, I don't seem to get many bad days now. I chomped through quite a few casts when I was in hospital the other day. But generally going on, I might get through 8 or 10 casts a day, which is still quite a lot more than average, but generally going on, it's a good day for me. If I get through less than 10 casts a day, it's a good day. This is over a 24-hour period, basically, so it's not waking hours, it's a 24-hour period. Worst case scenario, both with augmentation, it doesn't work. Well, there's 2 worst case scenarios. The lower end of the worst case scenario is that it improves the capacity, but doesn't mean that I can come off my meds or go back to drinking a very dark, which would be a bit of a bummer, really. I do miss, cold glass of cherryade or a cold glass of fizzy cider, and it just makes such a pain when you go out to drink. I can't drink fresh orange juice. You can't drink anything fresh. You can't drink fresh juice at all. You can't drink anything acidic. You can't drink anything citric. You can't drink anything with caffeine in it. You can't drink anything that's fizzy. I can manage, I suppose, with a glass of wine, small glass of wine with a meal, bit of Baileys, maybe a shot of whiskey. I can have a bit of still cider if I can find somewhere that keeps a small amount. Unfortunately, still cider doesn't seem to be sold in small quantities anymore. I can't really drink it often enough anymore to get through a large quantity. So I never was a big fan of wine or ales or bitter sort of thing, Guinness, such like. So these days, really, I'm pretty much on a wagon. Some people turn around and say, we choose not to drink. Yeah, you choose not to drink. No, I'm put in the same category as being on the wagon, like an alcoholic sort of thing. I don't like it. No, there's a big difference between going to the pub and thinking, I don't want to drink tonight, or I'm driving, or can't be bothered. But when you're suddenly told you can't have a drink, and what you can drink basically is dilute squash. I drink dilute squash now, have a couple of mugs of decaf tea a day, and maybe a bit of hot chocolate. That's it. No, all right, it's better than drinking plain water, but it's pretty fucking boring at the end of the day. And 35, 40 years of this, he's going to get a bit tedious. So the hope is that the augmentation will allow me to go back to drinking within moderation what I want. That's the hope. I said the big worst case scenario with the operation is it doesn't work at all. Doesn't improve the capacity and doesn't do anything else, but will leave me permanently cast. Now, I cast permanently all the time anyway. But if, for argument's sake, I stopped having the botox within 6 months, I could probably go back to peeing how poorly I did before, about 5-6 mils a second. There's no point in me coming off the botox because the botox, it does that with all the tablets, and the diet does give me, well, put it this way, instead of having a very poor quality of life, I've only got a poor quality of life. That's the difference. It's about as good as it gets, really. Keeps everything stable, which is about as good as everything gets these days, really. I don't quite know what the temperature drop is going to do. We've had quite a warm summer. Luckily, we haven't had any real peak temperatures, so they've stayed quite level. At the moment, we're in middle of October, and I haven't had to go back to wear my thermal leggings yet. I will do as the temperature drops. I'm just hoping that it doesn't affect my bladder too much, because this year there's nothing else. There's no meds, there's no botox increases. What happens this winter is what happens. So I'm hoping and praying that things will stay quiet. Obviously, when I have the augmentation, I said about the bladder wash, because mucus is, you've got to do bladder wash-ups 2 to 3 times a day. It's all done with saline solution, syringes, all through your cath. Again, it's got to be done for the rest of your life. Try and keep the mucus moving. I've spoken to a few people that have serious problems with mucus, and I hope I'm not one of them. There's risk of bladder stones, there's risk of infections, and the mortality rate is actually higher after the op than during the op itself. No, I think the op is only about 1 in 1,000, which is equivalent to a hysterectomy or bowel bariatric surgery. But yeah, the mortality rate is actually higher after the op than it is during the op itself from complications. Basically, you get a leak in your bladder, it's going to be fatal. No, if it's leaking into your abdomen and you aren't aware of that. But hopefully, all things being well, if the bladder heals as it should do, and I don't go doing anything stupid afterwards, they reckon 6 to 8 weeks to 90% pre-op. I've got to check that with Professor Ashim, because I think, given the fact I work in construction, that might be a little bit optimistic. We've made allowance for me to have 12 weeks off work, which should be more than enough for me to heal up. Another reason I didn't want to go down the route with cystectomy is that although there are bodybuilders out there with urostomies or colostomies obviously where you have a bowel diverted into a stoma bag, nobody can guarantee what you can go back and lift. And obviously building, I have to be able to deadlift 55 kilos. Some of you might think that's 20 kilos more than the average male should lift. Don't care about average males. This is what I'm capable of lifting. Now, for my job, I have to be able to deadlift 55 kilos, rolls of lead, lintels, plate compactors, concrete blocks, bags of cement. No, you've got to be able to lift 55 kilos. No, you aren't going to do a lot of building if you're pissing around with 25, 30 kilos. And nobody can guarantee that with a urostomy. And I can't be put in a position where suddenly I can only lift 50 or 20 kilos because you ain't going to do shit building. I'm not clever enough to become a sparky. I don't particularly fancy plumbing for the rest of my life. And even then, you've got to be able to lift boilers and such like. So really, the bladder augmentation is it's a one-way ticket, but it's going to be, I'm only going to explore invasive surgery once. Like Professor Sim said, he's had a couple of patients, started off with a TURP, gone to augmentation, then gone to cystectomy and still get sensory urgency. I could not think of anything worse, to be honest with you, to have those sensations and no way of getting rid of them. So I'm only going to explore invasive surgery once. If this operation doesn't work, that will have to be life for the rest of my life at the end of the day, and I'll have to deal with that. But hopefully, I'm confident. I know my body. I know my symptoms. My hunches since the start have been right. If I felt, I don't know how this is going to work, or don't know this is what the symptoms are, I know my body, know my symptoms. I'm confident that the augmentation is going to work, even if it just increased my capacity. I could live with a restricted fluid diet, and the meds is again, it's inconvenient. You've got to make sure you keep everything ordered from the doctors. You can remember to take them in the morning, but it's not the end of the world. They don't really cause many bad side effects. It's only mirtazapine. I've had to go on the dark because the bloody mirtazapine that I'm now on 30 mils of mirtazapine. Anyone wondered what that does? Between that and my wife stops me committing suicide, basically. No, that's the long and the short of it. It does help my mood a little bit because my mood was getting quite aggressive come September, so we upped my mirtazapine to 30 mils, but unfortunately one of the side effects is weight gain, so I'm now trying to lose at least the weight the mirtazapine has put on at the very least. And now I'm on the proper waiting list at Trellis. They're fussing about pre-ops and BMIs and all the fucking rest of it. And yeah, losing 2 or 3 stone is not gonna it'll trim me up a little bit, and it's not going to really hurt. Closer and get my BMI back down to 30 again, the better. Really, it's never going to be never going to be down to 25. No, end of the day, those that know me, I'm on a heavy frame with a lot of muscle. Sorry about that.